Today's Community Spotlight features the Idaho Community Care Program. And we have Lynn Faines with the Idaho Commission on Aging and Julie Torsini with the Southwest Idaho Area 3 Agency on Aging, who are going to be presenting.
Thank you very much, Mary, for that introduction. I'd like to give you some background on how this program came to be. Last year in 2022, Idaho Commission on Aging was allocated $720,000 to implement a program supporting caregivers for those caring for loved ones with memory loss. ICOA's brilliant contracting officer rated this funding with 2 public health grants, where we're able to begin developing the infrastructure and framework, partnering with Southwest Area Agency Area 3, Julie Torsini, caregiver support extraordinaire subject matter expert, to implement the following Idaho Community Care Program. And I'm going to have Julie tell you about the program.
Thank you, Lynn, and thank you, Mary, for the introduction. And just as a program and as an agency, and just for myself personally, we really appreciate the opportunity that we were given with Idaho Commission on Aging, and in particular, Lynn, for the opportunity to launch and spearhead this program. As when any new program launches, you start right away with several lessons learned. And when I was preparing for this presentation this week, I just sent Mary this PowerPoint first part of May, and I looked at it this week and I thought, yep, it's already changed. There's already, within a month, we've already changed kind of, just with those lessons learned. Lynn has been just very supportive, and I too appreciate Lynn's military background. Lynn is always still on military time, although she says that she doesn't, this is early, but she's still always on military time. But just in-house, Raul Enriquez is our executive director for Southwest Idaho Agency on Aging. He has tremendous involvement within this project, and just our community partners, everyone who's on this call, along with Janice, is a huge support for us, Aging Strong, and the other agencies on aging throughout the state of Idaho have been also heavily involved in this project and super supportive, because at the end of the day, right, we are all here to support caregivers and what those caregivers' needs are. So I'm excited to share with you all what Idaho Community Care Program is. And we reference it a lot of times as iCare, and or in-house we call it CCP, to shorten the name. But this is our logo here. And Idaho Community Care Program, in a nutshell, is information, support, and education to caregivers, family, and other loved ones taking care of an individual with memory concerns, dementia, or Alzheimer's. I think we all know you have to really work with your wording so that your everyday citizen can get a snapshot of what you are trying to present to them. My judge is my 75-year-old mother. I always look at everything as, would she be able to understand what I'm talking about? So what do? We provide so we took the care and we came up with case management, advocacy, respite, and education. This is a statewide initiative. I'm based here in Southwest Idaho, so in the Ada County area, but this program is for the state of Idaho. And the philosophy also behind this program is caregivers across our state of Idaho are all offered the same services. And so it does not matter if you are in Sandpoint, Idaho, or Arco, Idaho, or Boise, Idaho. You have access to the community care program and all of these services that it provides throughout the state of Idaho. So once again, I'm the program supervisor for Southwest and Central Idaho. We have Amanda Browner And Amanda and another staff member, James, is at the conference in Twin Falls, which is the first Hispanic and Native American conference that's being hosted. So Amanda Browner is at that event right now. Gail Kennedy is on this call. Gail Kennedy is a community health advocate. She covers 5 of our very rural communities, counties under this program. Charlie Hahn, Kinship Resource Coordinator, but Charlie is a jack of all trades and has some community care program caregivers that she helps to serve. So she's kind of a jack of all trades, and we kind of pop her in where we need her with some of our caregivers. Amanda Olson is our intake specialist, and I'll come back to what Amanda's role and how referrals work. And then we have Elva Villarreal. She's also Charlie's partner in crime. She's our Kinship Resource Coordinator. She's also bilingual. So she does carry our bilingual or monolingual speakers under this community care program as well. In the eastern part of Idaho, we have James Finley. He covers all of eastern Idaho. And then we have Tia Briggs, and she's actually located in Idaho Falls, small town Rigby. And so she covers some of those rural communities in that area for us. And James is also bilingual, which is very nice to have on staff as well in the eastern part of Idaho. And then we are interviewing for the northern half of Idaho. In fact, the team and I leave and we're gone all next week interviewing candidates in northern Idaho. And so that would just think Coeur d'Alene, Lewiston area. So that is considered northern Idaho, and we are interviewing to fill the spot for a community care manager in that area. So fingers crossed that we are able to interview and locate a really great candidate in that area. When I describe community care program, I do say, you know, we are one piece of a very large puzzle for us as a state of Idaho to bring awareness to Alzheimer's disease and related dementia. Our piece of the puzzle is caregivers, but this is a statewide initiative that we as citizens of Idaho have awareness of dementia and Alzheimer's, and our piece is the caregiver piece of this puzzle. So our mission of community care program is to support caregivers of persons with Alzheimer's disease and related dementias to ensure the highest quality of life possible while living at home. In order to accomplish this mission, the community care provides information, support, and education to caregivers, families, and other loved ones. We provide caregivers with the tools and services they need to effectively navigate their health and life options with care management and consumer-directed options. And we extend the reach of these services into underserved rural communities and those in greatest need. And we are, our mission is to reduce caregiver burnout and prevent or delay the need for a higher level of care for the care receiver. So how do we accomplish that mission statement? We do this through what we call community care managers and community health advocates. And these community care managers and health advocates are trained professionals who provide the support for these individuals who are taking care of their loved ones. You know, starting to kind of get into the referral process, it just in my experience, you tend to see 2 types of referrals that come in. Maybe I'm just going to give an example, a daughter who's kind of getting a feel for what's out there. She knows mom and dad. She knows mom's taking care of dad in the home. She knows it's starting to get a lot, but mom's maybe not wanting any help at that moment. And so the daughter on her side is kind of starting to research what options do I have? What options are available for mom? And she's getting worried about her parents. And so a lot of times I call those can be kind of feeler calls, right? They're getting a feel for what's out there. So those type of referrals come into our intake specialists. And so we're providing that information, you know, well, here's powerful tools for caregivers. Here's some support groups. This is what Respite is. This is what an agency on aging does. So we call those calls kind of, inquiries. They're getting a feel for what's going on. And then the second major referral is you do have a caregiver and they're looking for assistance coordinating those services. And so at that point, that's when the community care manager and community health advocate becomes involved. We do home visits. So I said we go wherever the caregiver would like to meet. So we go home visits. Some like to meet at a separate location so they can discuss what's going on without their loved one hearing them. But we meet with that caregiver and we work through an assessment and we help them identify what their needs are. And then based off of what their needs are, we're developing that plan that focuses on their wants and needs. And from that plan, then we're setting their goals. And then we're helping them to establish a routine for that ongoing support. And then my big thing that I always say is we're the point of contact. So from beginning to end, we're that caregiver's point of contact. So they know who to call. Because as we all know, the minute you start getting transferred around, the minute something becomes a burden or you have a bad experience, you are most likely not going to reach back out. So we always say we're the point of contact from beginning to end. In starting this program, I always also just say my whole career, I've always had a voluntary relationship with my clients. I've always served at their pleasure. And on this program, I said, we're there at the caregiver's pleasure. They're inviting us into their home and into their lives because they're looking for that assistance. And in my professional opinion, that's the best relationship that you can have when you're serving at someone's pleasure. This can be a little redundant, but the type of referrals that we receive or that we would be looking for are individuals and caregivers who are taking care of a person with memory concerns. They're looking for assistance coordinating those services. They're looking for resources, referrals. And we're also open for anyone who's just also seeking information on memory loss, dementia, Alzheimer's. All of us have friends. We get several calls from, it's just my friend. I see that she's starting to get some dementia. And I'm just looking for extra information because I want to support her. So our contact information is, I've added this slide. If you've ever been on a3ssas.com's website, it's been a little bit lacking, and it just recently went up through a website update. And so it is still in a test phase. The links are not all correct, but it is up and running. Our website, and as I mentioned, community care program will be on the website hopefully by next week. This is the main contact number, 208-898-9626. So we have geared this to where this is the phone number, this is the email for the state of Idaho, so that there's one central entry point for our caregivers. Amanda Olson is our community care intake specialist. Unless she's on vacation or we let her have a day off, she is who these caregivers would reach when they reach out via email or phone. And Amanda, then escalates it or transfers it to then the appropriate person. So if they're looking in the eastern part of Idaho, then she's transferring it over to our community care manager in that area. So it is one central entry point that we have tried to create so that once again, our caregivers don't get confused.